An introduction to oral health. In this lesson, you will learn the basics of oral health. You will understand common dental problems and how to recognize them, and you will learn what people can do to prevent these problems. Perhaps most importantly, you will gain a new appreciation for the importance of oral health and quality of life, and new ideas for roles you can play in supporting the oral health of others. You'll notice a special feature of this lesson is that there are few opportunities to pause and consider what you would do in particular situations. When a "what would you do" slide comes up, feel free to pause and consider what you would do in these situations. In this section, we will talk about the role of oral health in quality of life and review the interconnections between oral health, whole health, and mental health. Oral health matters, and it matters all across the lifespan. But many people, even healthcare providers, do not have a deep understanding of the importance of oral health. This is one reason why the U.S. Surgeon General report on oral health called dental disease the silent epidemic. Let's start with oral health in children. Many people think that caring for baby teeth isn't important because they will fall out anyway. Unfortunately, this isn't true. Dental cavities is the single most common chronic childhood disease, 5 times more prevalent than asthma. Tens of millions of school hours are lost each year due to kids' dental illness. Pain from oral health problems affects children's ability to stay focused in school, and it affects their self-esteem when their teeth are visibly decayed. Baby teeth are space holders for adult teeth, and losing baby teeth prematurely affects speech development. Adult oral health is tremendously important too. Employed adults lose over 100 million work hours each year due to dental disease or dental visits. There is research showing that employers sometimes discriminate against hiring people with visibly decayed teeth. Among adults, visibly decayed teeth is associated with shame and social impairment. Some even report that they avoid smiling and laughing due to shame. Imagine what effect it has on people's mental health when they are actively trying not to smile or laugh with others. Oral health is even important for people with no teeth. 30% of adults 65 and over have lost all of their teeth. Some believe this is just normal part of life, but that isn't the case. Tooth loss is preventable at any age. Gum health and denture care continue to be important even after people have lost their teeth. Just think about nutrition as one example. Without teeth or with badly fitted dentures, chewing nutritious foods becomes more difficult. These are just a few ways that oral health matters, and this is why your role is so important to help others and to help other people to see that oral health matters too. For historical reasons, dental care is separate from medical care in the United States. Many now see this separation as a mistake that has had negative consequences on health. We know that oral health is deeply connected to systemic health. Poor oral hygiene and untreated dental diseases are linked to serious illnesses like pneumonia, heart disease, and diabetes. It is also linked to problems in pregnancies. Recent research has even shown that simple gum therapy in a dentist's office can actually improve outcomes related to diabetes, heart disease, lung disease, and pregnancy. Helping people understand that their oral health affects their whole health is one important role you can play in supporting the people you work with. Despite progress by healthcare systems towards integrating mental health in primary care, oral health is often left out of the picture. Remember how kids with decaying teeth face self-esteem problems and that many adults with tooth decay avoid smiling and laughing due to feelings of shame? These are just a few reasons why oral health and mental health are connected. And there's more. Research has shown that people living with psychiatric disabilities have a greater risk of oral disease and have greater oral treatment needs than the general public. But despite their greater need for oral health care, many people living with psychiatric disabilities avoid dental treatment due to concerns about mental health stigma and perceived lack of access to affordable care. Overall, the basic picture is that there are deep connections between physical health, mental health, and oral health, but our healthcare systems sometimes treat these issues separately. Take a moment to consider how the separation of primary care, mental health, and oral health has negatively affected people's whole health. How has the separation affected the people you work with? How has it affected you? Here is an opportunity to pause and consider what you would do. A parent mentions that their child has a toothache. Since it's just a baby tooth and will fall out anyway, the parent does not plan to take the child to a dentist. What would you do? What facts might you share? Let's review. Poor oral hygiene and untreated dental diseases are linked to the following ailments: pregnancy complications, reduced self-esteem, heart and lung disease, or all of the above. In this section, we will talk about common oral health problems that you can prevent through education, home care, and preventative care. First, we will talk about cavities, and then we will talk about gum disease. On the most basic level, cavities are just a hole in a tooth. Dental caries is what dental professionals call the disease that causes the cavity. What many people don't know is that cavities are caused by certain types of bacteria. So just like any bacterial infection, dental caries can be passed from one person to another. That means that if someone in a family has active caries, they can pass it to another person in the family if they share utensils or toothbrushes, or if a parent touches a baby's bottle or pacifier with their mouth. You will learn later in this lesson that brushing and flossing help remove bacteria from the teeth, which lowers the risk of cavities. Just like cavities, gum diseases are also caused by infections. Gum diseases are related to dental plaque, which is the soft, sticky film that builds up on teeth. Plaque has lots of bacteria in it. When you brush or floss, you remove plaque and bacteria from your mouth. The milder form of gum disease is called gingivitis, which means that the gums are becoming inflamed or swollen. The more severe form of gum disease is called periodontitis. That's when the gums and bones that support the teeth are infected. Without treatment, periodontitis can result in tooth loss or sores in the mouth. When you go to the dentist, you may notice that the dental professionals will scrape your teeth with special tools. That's how they remove the bacteria-filled plaque from your mouth. Brushing and flossing are great, but they cannot get all of the plaque off of your teeth, especially if it is hardened. That is one reason why regular dental appointments are important, even if you do not have tooth pain. You've now learned about two common oral health problems: cavities and gum disease. What puts people at risk for these preventable diseases? There are a few important risks for you to keep in mind. One risk is lack of regular dental care. Remember, dental appointments are when dental professionals can remove the bacteria-filled plaque from your teeth with special tools, which toothbrushing often can't do alone. There are many reasons why people do not go to the dentist for regular care. They may not have insurance, or perhaps they do not realize that their insurance covers dental care. They may have transportation barriers or may lack child care. They may not be able to afford appointments even with insurance. They may also not really understand why regular dental care is important. Many people think that you should only go to the dentist if you have a tooth pain, and many people think that baby teeth are not important because they will fall out anyway. A second risk is home care habits. Not brushing or not brushing often enough can lead to oral diseases. Nutrition is important too. Sugary foods and drinks lead to the mouth becoming more acidic, which is an environment that bacteria likes. Medical conditions can create risk for oral diseases too. Many medications cause people's mouth to feel dry. These medications actually decrease the amount of saliva in people's mouths. A dry mouth increases the chances of cavities and gum disease. It's common for people to drink sugary beverages when they have a dry mouth feeling, but sugary beverages makes the mouth get even more acidic. Finally, a lack of fluoride can be a risk factor for oral diseases. Fluoride is a natural mineral that helps strengthen people's teeth and reduces their risk of cavities. People usually get their fluoride from two sources: tap water and toothpaste. When people do not have access to clean tap water, or when the community has opted not to fluoridate the tap water, this puts them at greater risk for oral diseases. When people do not use fluoridated toothpaste, perhaps because they do not see the value or they can't afford it, they lose a great opportunity to strengthen their teeth. You have now learned about two common oral diseases, cavities and gum disease, and some of the factors that put people at risk for getting these diseases. Now, let's talk about warning signs that an oral disease could be present. Because you are not a trained dental professional, it is not your job to diagnose any oral health problems, but you can recognize signs that something could be wrong and help the people you work with figure out how and where to seek dental care. Some warning signs to keep in mind are red, swollen, tender, or bleeding gums, bad breath that won't go away, loose teeth, sensitive or sore teeth, gums that pull away from the teeth, dry mouth, and mouth sores that won't go away. Here is another opportunity to consider what you would do. A person mentions that a few of her teeth are loose. She has not been to the dentist in many years. She says she figures she will have to get dentures because most people in her family have them. What would you do? What facts might you share? Let's review. What are potential risk factors for oral health problems? Lack of routine dental care, dry mouth, flossing daily, or poor toothbrushing habits. Now that you know a bit more about oral health problems, now let's talk about how to prevent them through home care and health care. People should brush their teeth at least twice a day. That morning brush is important, but even more important is that nighttime brush right before bed, so that there isn't bacteria right up against the teeth all night long. We recommend that people spend about 2 minutes brushing their teeth so that a lot of plaque comes off. Be sure not to push too hard though. Some stores do sell very hard toothbrushes, but it's better to get soft or extra soft toothbrushes. The reason to get a soft toothbrush is that it's easier to damage the tooth and the gums with a hard or even a medium toothbrush. Many people are taught to rinse out their mouths to get the extra toothpaste out. You might be surprised to learn that we do not recommend rinsing after toothbrushing. We recommend spitting out the extra toothpaste and then not rinsing, eating, or drinking for 30 minutes after brushing. That allows the fluoride in the toothpaste to stay on the teeth to improve dental health. Flossing is important too. Brushing will get the food and plaque off the surfaces of the teeth, but won't clean in between the teeth. Flossing will help with gum health. Earlier in this lesson, you learned that sugary beverages cause oral health risk and should be avoided. They are acidic and cause bacteria to grow. The same goes for sticky foods like candy or potato chips. The problem is that for many communities, sugary beverages and sweet, sticky foods are difficult to avoid. They are inexpensive and they can be highly addictive. If people feel they do not have a choice but to drink sugary beverages and eat sticky foods, they can help protect their teeth by brushing teeth or even just drinking water afterwards, which can help wash away the sugar and acid. Avoiding these foods is preferable, but if avoiding them is not possible, rinsing is one way to lower the health risk. Here is another opportunity to consider what you would do. A person who takes a medication mentions that his mouth is dry a lot, and he does not know why. To help with a dry mouth, he drinks pop throughout the day. He says his gums have felt sore and swollen lately. What facts might you share with him? It's tough to motivate people to change their habits. What strategies would you use? What pitfalls would you avoid? Even before babies get their first tooth, parents can start supporting their kids' oral health. Before babies go to sleep, parents should wipe their gums with a soft, clean cloth. Parents should not put babies in the crib with a bottle, even if the bottle just has milk or formula in it. That is because sleeping with a bottle makes the liquid pool in the baby's mouth at night, which can cause cavities. Adding sweeteners to the baby's bottle at any time of day can increase oral health risk. When brushing kids' teeth, only use a grain of rice sized amount of toothpaste when the first tooth appears. When the child starts to be able to spit out toothpaste reliably, you can increase it to a pea-sized amount. Parents should help their kids brush their teeth until around 8 years old, because before that, kids may not be coordinated enough to really get the plaque off their teeth. And remember, caring for your own mouth will help your kids too. It will decrease the amount of bacteria you have in your own mouth, and it will demonstrate to your kids how to maintain their oral health throughout their life. So far, we've talked about preventing oral health problems through home care such as brushing, flossing, and nutrition. But going to the dentist is important too. We recommend at least one dental checkup per year, even if there is no toothache for kids and adults. Baby's first dental checkup should happen 6 months after the first tooth comes out. You learned earlier in this lesson that when dental professionals scrape the teeth during a checkup, they are doing more with their tools than people can do with a toothbrush and floss from home. They also examine the mouth for treatable problems like cavities, gum disease, and even oral cancer. Encouraging people to go to the dentist for a checkup, even if they don't have a toothache, can help promote oral health. The problem, of course, is that many people do not have access to dental care. You learned earlier in this lesson that people may have low access to dental care for several reasons. They may not have dental insurance, or may not realize that they do have dental insurance through their current plan. They may have a transportation or childcare barrier, or they may not fully realize the importance of dental checkups. They may not be able to afford a copay or the cost of a procedure because they need to spend their money on other things. When it comes to access to dental care, there's a lot we do not have control over. For example, we can't make dental care more affordable, and we can't fix a lack of public transportation options in a community. But there are a few things that we can do. We can help people figure out what their dental benefits really are. People may be surprised that some dental care is actually covered. We can help people find options for free or low-cost dental clinics. We can talk with people about the importance of oral health to help motivate them to take action. And we can also help address the stigma people feel when it comes to oral health. So many people feel shame about their teeth, and so many people fear the dentist, partly because of the shame they feel. You can make a difference in someone's life when you help them overcome any avoidance of the dentist that comes from stigma or shame. Many people also hate or fear going to the dentist. Some people will avoid dental care for so long that they get a tooth infection. This extremely painful condition often pushes people to an ER for treatment. It is important for people to know that an ER visit will not treat the underlying problem. ER treatment will be a temporary fix that can only be cured at a dentist's office. Here is another opportunity to pause and consider what you would do. You are newly hired at an organization, and you've noticed that your new employer does not do anything to promote oral health. What would you do? In this lesson, you have learned the basics of oral health. You now understand common dental problems and how to recognize them. And you have learned what people can do to prevent these problems. Perhaps, most importantly, we hope you have gained a new appreciation for the importance of oral health in quality of life and gotten some new ideas for roles you can play in supporting the oral health of others. Oral health presents you with an amazing opportunity to make a difference by providing education, motivation, and linkages to dental care. Thank you for joining us today.